Welcome to another CEO Wisdom podcast. We have Hubert Zajicek with us today. He's CEO, co-founder, and partner at Health Wildcatters. So I'm excited to jump right in as we only have 20 minutes. But Hubert is a serial founder, still founder and leader at Health Hacking Crisis Network, president of Rotary Club of Dallas for a year. And yeah, very interesting guy altogether, an MD and MBA. Hubert, welcome to the pod. Tell me a bit more about yourself and what you're up to nowadays.
Thank you for having me. Yeah, I just background-wise, I come from medicine originally, spent some years in science, and then the last 15 plus years now, more like 17, 18, with healthcare startups, investing and accelerating them. The last 12 with Health Wildcatters, which I co-founded.
Right. And you're an MD. Why switch to the risky startup world?
Well, it's a longer story, but I mean, originally I'm from Austria, and I kind of got into the science piece of things and enjoyed that for a while. And then I was at a fork in the road. Do I want to go back into clinical medicine and do residency, or do I want to do something else? And so something else turned out to be business school. I did business school, and when I went through that, I fell in love with entrepreneurship, and so that's what I did ever since then.
And tell me about Health Wildcatters. Why did you start it, and what do you guys do exactly?
Well, we are there are four partners in Health Wildcatters. We're all angel investors, and originally we got Health Wildcatters started with the help of another accelerator that had kind of a general tech theme to it. But the health accelerators were fairly fresh and young 12 years ago. There weren't many specialists, but all four of us that are involved here are deep in healthcare. And so for us, it made sense to use our expertise, backgrounds, and connections to help those now 118 startups that we've accelerated to date.
Interesting. And what startups are you looking for? What are you looking in? First, the concept, right? The idea, and second, in the founders that you're helping out.
Yeah, that's right. I mean, we are pretty broad funneled in the sense that we look at startups in healthcare that can move the dial, anything that's venture fundable. So the only exclusions would be like healthcare real estate or hospitals or physicians' offices and things like that, operating companies. And that traditionally falls under the private equity anyway. So we're more on the venture capital side. So technology, usually some tech secret sauce. And yeah, so that's kind of where we live with respect to the different types: healthcare IT, medical devices, pharma, tech-enabled services, diagnostics are all up for grabs, and they come from all over the world.
And what are you looking for in a founder?
It's, I mean, what's going to grab our attention is what you're working on. I mean, is this a field, an area where we think there needs to be improvements? Is there something where we see opportunities? But very soon, as soon as we get past that top line there, we're listening to you. It's all about the founders. At the stage where we invest at the pre-seed level, it's all about the team. It's all about the founders. And the way I describe it is, if the founder falls off a bridge, there is no startup the next day. There's nothing of value recoverable. So it all depends on the execution of the founder. And generally, we look for someone who is obviously early and wants to be a part of the accelerator, but also is coachable and is open to listening. Because our formula is take a startup that's early and add our network of hundreds of mentor investors to, over the course of 3 months, help you significantly advance your startup.
Right. And the angel investors and family offices that you raise your money from, like, how do you target them? Are these referrals people you know, or you have an outreach program, and is it more like systematized?
No, it's pretty word of mouth. So when we started, we had a good Rolodex of people already, and we just put word out, and people filled our first fund. And ever since then, we've just relied on, if we're doing things right, then people will come. If we're if we don't, we can't and don't want to force it. So over 12 years now, we've been blessed with over 150 angel investors behind us and family offices. So.
And what's the health of the portfolio? Can you give us an idea of, like, if I would have invested in the fund, what kind of return I would have got over a 10-year period?
Yeah, I mean, probably if you were to look at our first couple funds, you would find a 4 or 5x return there. That doesn't mean that it's materialized all of it. There's still some value in these funds. And as you get further down and closer to the younger funds, that would drop off over time. There is significant variability in these 12 funds, depending on the year, the vintage, what happened. So even within an N of 10 startups per year, in some cases, some popped earlier and grew, and others took a long time to grow. And of course, you've got also variability in which ones need to redirect and start over with something new.
Right. In your profile, you say your purpose to reduce human suffering. You've started Health Hacking Crisis Network 5 years ago. Tell me a bit more about that charitable aspect of yours.
Yeah, that was born out of the pandemic. I mean, we're looking at, March of 2020, and it appeared that there was going to be all sorts of regional issues with shortages of PPE and other problems. And our network was extensive, but it had never been asked to help. And so basically, I just started a Facebook group and said, who wants to join? You need to be willing to help for free and have a relevant background of some kind. So you need to be willing and able to give. But of course, it did have to be someone who can contribute to a healthcare endeavor. And in that sense, we did a variety of projects that were geared towards, you could say, maybe an apocalyptic scenario of, if we can't make masks anywhere shipped here to Dallas, what do we got here, buddies? Can we make it ourselves? Who's got the factory? Who's got the expertise? Who's got the leads so they can make things regionally or locally? And that could, obviously not just masks, but that's just a good example. Like, how can we solve for these things regionally with the help of what ended up being over 500 volunteers? So we did make masks and shields and various other things. And luckily, the situation ended up, resolving itself. But out of that was we created this 501c that continues to look at problems and issues that might emerge in certain situations, and also helping people think outside the box, right? Think about what do you do if you can't just go to the grocery store and buy XYZ? Can you make it? Chances are you can't, but with enough friends around you on a Zoom link, you probably can figure out a whole lot of stuff. So that's how we operated.
Right. And what are the biggest health problems that the world is facing right now, and how are some of your health tech startups currently helping fix these problems?
Well, so as far as our startups goes, it's quite diverse. So some are tackling, on the pharma side, tackling some, usually a single disease, a single problem. In that sense, we're not even with the 118 aren't diversified enough to say we cover every single aspect of human suffering. My personal motto is to relieve human suffering. You're absolutely right. And but when we're looking at startups, we have to see something that has a market, something that has a significant market size, that a startup can actually gain traction. And the various things we're working on, or the startups are working on, is anything from early cancer detection to obviously cures of cancer and various other diseases and ailments, to medical devices that help people that have maybe lost sensation in their feet, or just anything from smaller issues to larger ones, with a realization and understanding that a lot of these things are going to cost a lot to start with. But as these innovations get rolled out, as significant efficiencies are gained, and these inventions can become available to anyone in the world.
Right. You were president of Rotary Club Dallas, which missions to unite leaders around the world of all backgrounds, promote goodwill and peace around the world. What do you think is the current situation in this world? Are we heading for peace, or are we heading towards a war and it's getting worse?
I think there's a lot of noise out there right now that when you read kind of more regional news or try to dig in, you realize that unfortunately, with the kind of everyone watching like 2, 3 things in the world, there's a lot happening that's not good under the radar screen. When you think about Congo or South Sudan or many areas where some bad people get away with a lot right now. Rotary doesn't take, Rotary is an international organization of over 1 million people that generally does good works in their own community, but then also helps other communities around the world. In that sense, we've provided support for fundraisers for Ukraine, for instance, at the time, or for the fires in Maui, or the hurricane victims in Asheville. You name it. If something happens around the world, Rotary creates a network of people who are well connected regionally with 40,000 clubs around the world that you can plug in with another club around the world and then use them as your interface boots on the ground based on some very clear business and world ethics around treating everyone with respect and dignity. So it's a nice network and mechanism by which you can exert a lot of change. And in that respect, Rotary, together with the Gates Foundation, can take credit for having a huge impact on polio. Polio eradication around the world was spearheaded by those two organizations. So there's some really cool things that happen, but as where the world goes, I don't know. It's looking, unfortunately, it's not looking too great for.
And is it because of the media overspread of bad news, or is it really statistically not getting better?
I think it's many things happening at the same time. I mean, you'd really have to focus in on a single conflict or region, or to I think get closer to a reasoning of why certain things are happening. But there seems to be, I think we're dealing with certainly a wave of more regionalization, possibly in response to an overwhelming or irrational exuberance around globalization for a while. So in that respect, sometimes I look at the United States as a good example of how you can set up a framework of certain agreements that we all can agree on, but you can live in Texas under certain rules. And as long as those overarching rules don't get violated, you can be in California and have, different rules and laws in your own region. And so that's kind of important to have, so that I think in the case of the United States, allowed this country, for the most part, except for the Civil War, of course, to come to an agreement that you don't have this top-down situation where everyone tells you how to live your life. And fundamentally, as an immigrant myself, I feel like that's a very important thing, to feel like you have self-determination. And within the framework of the United States, anyway, where we don't have the same situation as Europe, you can find, meaning that there's ethnical division. I mean, you're in Spain, you're probably Spaniard. You're in France, you're probably not all of you, but a large portion. In the United States, we're a lot more homogenized, but you can find your place where you're comfortable and you like everything, and you have the freedom to move around and move to wherever you want to be at. So I think you're always going to have some back and forth between federal and state rights, but it feels a little bit like that the whole world is tilting towards regional self-determination a bit more. And so you see a lot more strife possibly, but it's hard to say because we're running so fast. Maybe it's all just amplified with media bits and bytes, and these things have been happening at the same pace all along.
Right. Well, look at this. I looked at the stats here, and the peaceful countries have gone 1% more peaceful since 2008, it says. And then the 25 least peaceful countries, I've seen a 7.5% decline in peacefulness. So the least peaceful have gone more least peaceful, right? And then my brain was like, oh, once they have a war, do they become more peaceful because they realize that it's like disgusting and so toxic for a country to go at war? It's a good question because US hasn't done so, but US is hegemonic power. So thank you for being on today. It's been quite insightful work, and people find out more about you, Hubert.
Just healthwildcatters.com. And we're located physically in Dallas, but our startups come from 12 countries and 39 states, so pretty easily findable. And you'll find one of our startups maybe in your own backyard.
Thank you for being on. That was Hubert Zajicek, or trying to pronounce that word right, and Charles Cormier for another CEO Wisdom Podcast.com.